Views चल रहा है? Hello guys, so welcome to today's session. Just give us a quick confirmation that we are audible and visible. Can somebody please confirm if we are audible and visible?
Hi, good evening everyone. I hope the audio and video is fine.
Yeah, I think we are live. So thank you all for joining in. And today is not a study session that we'll take with you guys. I thought today let's take a brief overview of how to approach the first year radiology residency as the topic suggests.
Before that, Rishabh, let us congratulate all of them to now having a major transition of from our students to our colleague. So welcome to the world of radiology. This session is specifically for the students who have entered into radiology, and some of them have been guided by your second year, but some of them are still clueless that how to approach the radiology residency. You have mixed plan. You have heard from your seniors. Some of your seniors are saying it's a wonderful program. Some of your seniors are saying अरे यार कहाँ फंस गए तुम, right? So then you have come up with the lot of expectations in your mind that taking radiology means now तो life is sorted है, chill करना है ना, हर रोज एक पार्टी करनी है, right? And but on the other hand, some of the students are saying no, it's a radiology, you have to know about all the subjects, you have to read a lot, and then you are confused that CT, MR. So in this session, we will try to talk about everything that you should know as a radiology resident in the first year. Yes, sir. Do comment on my new hairstyle also. Yes.
Yes, so let's just start today's session. What I want to basically talk to you about is what have we achieved till now, what have we done till now. We have taken around 10, this is the 10th lecture or session as I would like to call it. We basically wanted to sort of do a demo run to make ourselves sure that yes, we can teach you. ठीक है, एक होता है कि यू वांट टू टीच अस, एक ये भी बिलीव होना चाहिए कि यार नीट पीजी से रेडियोलॉजी रेजिडेंट्स को टीच करना एक रिस्पॉन्सिबिलिटी है. So this was a test for us, and I'm very happy. I'm very uh, excited to take classes for you. In fact, I see 200 plus students attending our live sessions, and मतलब मुझे बहुत अच्छा लगता है कि इतने सारे बच्चे मुझसे सुनना चाहते हैं, and that is an honor for me, and thank you so much for that. Thank you so much for believing in me, believing in Rajat sir, that yes, we are capable of teaching you. Now, what we want to do in today's session is to talk to you about how to approach this first year residency, right? And please mention them in the chat box. So somebody has commented that, sir, your hairstyle is really good. Even I think so.
So you keep on trying the new things, new thing. Sometimes you have to keep beard, sometimes you have to remove it, sometimes you have to put all your hair back, sometimes you have to part. And so the radiology gives you time to experiment with your own body. I keep on doing this. Sometimes I reduce my weight by 10 kg and then I gain it by 12 kg again. You all have these charm to do in radiology. Yes, over to you.
So रेडियोलॉजी में आए हैं, रेडियोलॉजी में पोस्टिंग्स भी लगती हैं, रेडियोलॉजी में पार्टी भी करनी होती है, एंड रेडियोलॉजी में अनफॉर्चुनेटली यू हैव टू स्टडी. इनफैक्ट इट इज वन ऑफ दोस सब स्पेशलिटीज इन विच you have to study a lot as compared to others. A, because the syllabus is vast. Head to toe imaging you are responsible for doing for the whole hospital. Second, your patients are doctors. You're not catering to general population. You are doing scans for educated people who are practicing doctors, right? So you need to know more than them. And that is why, unlike other subspecialties or other specialties, radiology requires you to study during residency.
Rishabh, I want to add here. Now we have to come out of this taboo, and that what we keep on telling. Unfortunately, पढ़ाई भी करनी होती है. Let's limit that to the competitive exam when जब आप मन मार के पढ़ रहे हो, right? Here you are not studying because you have to crack an exam. Here you are studying because you want to learn the subject and you want to be of value to the other doctors. As Rishabh has mentioned, that now your patients are not general population. Your doctors are your patient because they are the one um, whose problems you are solving. So,
Yeah.
right. So once you start solving their problem, I'm telling you, you will have this from within, that yes, you have to study. You want to know more in comparison to your ENT surgeon.
Yeah.
You want to know more in comparison to a general surgeon, because a little bit of radiology they are aware, and
Yeah.
sometimes that little bit of radiology is more than what you know.
Exactly.
Because they are seeing the patient also.
Yeah.
They have a direct access to the patient, which you do not have, and
Yeah.
you feel from within that what you have to do. But in the first year, in which posting you can do what, that is what we're gonna try in this session.
So let's divide your first year into various postings. Now, if I'm not wrong, these are the postings that you guys will be posted in the first year: ultrasound, X-ray, fluoroscopy, CT scan, and MRI. Now, few of the colleges, few of the programs don't have MRI posting per se in the first year. That is sort of added on from second year onwards. But for the purpose of, let's say, completion, let me add it in the first year because some programs do. Now, some programs also have a DSA posting, but very, very few. Most of the places DSA postings happen in second year or third year. And in those places जहाँ पे है ही नहीं DSA, वहाँ पे होता ही नहीं है, right?
And in the posting, I mean, ultrasound posting can be further divided into emergency ultrasound, ward ultrasound, or X-rays. Sometime can be the orthopedic X-rays are separate, ward X-rays are separate, right? In fluoroscopy, the postings are divided. In some of the hospital, it's just an IVP posting, which is a separate posting, or a barium posting, which is a separate posting, right? Same with CT, it's an emergency CT or a ward CT or an OPD CT. So for the first year, these are the 4 standard postings that are there. And as Rishabh has mentioned, in some of the hospital, first year MRI posting in the later part of the first year, and in some MRI starts in the second year, and in some of the hospital MRI posting is not there, right? DSA, very few institutes have a DSA posting, but I have a doubt whether we have a DSA posting in the first year. Do you have
Very
DSA
rare.
and PGI in the first year?
Very rarely, when especially in COVID, when there was a crunch. So sometimes second semester towards senior first years used to get posted for an introductory posting. But yes, most of the places have it is in second or third year. So for the purpose of our residency, since we all have taken radiology to relax, to chill, and to sort of party, let's divide these postings into probability. कितनी पार्टी कर सकते हो, कितनी पढ़ाई कर सकते हो, right? So ultrasound posting usually free 9 to 5 if OPD, right? Or what, emergency ultrasounds 12 hours, little bit hectic. So can you party? Yes, you can party. But can you also get time to study? Yes, in ultrasound you should study. In X-ray again, do you have time to enjoy yourself? Yes, you can relax, but utilize this time as well to learn some important basic concepts of X-ray as well. So पढ़ाई करनी है. Again, fluoroscopy, yes, party. Also, yes, पढ़ाई. Now let's come to CT scan. And at most places, even if you're a first year resident, CT scan will be the most hectic posting of your entire radiology. Be it second year, third year. CT scans volumes in most hospitals are humongous. Around 50 to 100 CT scans are done depending upon which hospitals you are posted, and around 3 to 4 residents are posted. So per day you will be required to sort of report around 20 to 25 CTs. If there are SRs, थोड़े कम हो जाते हैं, but CT posting will be a hectic posting. So you will not get the time to party. It is a hectic posting, and you might not get time to study as well. So plus minus.
Yeah, and we will be talking about this also, that when we are saying padhai, what does that mean,
Yeah.
right? And how you should effectively utilize these postings. See, one thing that I want to clarify over here: no matter how much theory that you read, no matter who is teaching you, ultimately every subject, and specifically true to the radiology, is you learn by seeing the cases. You learn ultrasound not just by reading. You learn ultrasound by doing ultrasound, right? Even if you are not doing it, you don't get an exposure. Specifically, you are a DNB resident, you might not get an exposure. You might get frustrated from within. This is absolutely okay. Observe how your senior is doing the ultrasound, how they are identifying various features about a particular disease. If they are looking at a hydrated cyst, if they are looking at a complicated cyst, what are the differential that they are making for that particular disease? So keen observation, and and then actively performing the scan yourself and then reporting is gonna some that makes you a great radiologist.
Yeah, and CT scan, although you will get a little time, but seniors के पीछे पढ़ना. Your second years, your third years will teach you how to report a CT scan. अब जितना मर्जी पढ़ लो, अगर कोई सीनियर आपको बता दे कि CT pancreatitis में this things need to be seen. This is how you see it. That is the fastest way to learn anything, right? So now let's come to MRI. Some places will have MRI postings in first year, and again MRI is a cross-sectional imaging. Hectic होता है क्योंकि first year में आता भी नहीं है MRI, and number of MRIs also are a lot. So you will not get time to party, unfortunately, but you have to study in this posting, because if you don't study MRI, you will not be able to report it. Okay, MRI requires you to study during your posting.
Before we go forward, one sincere request to all the residents over here, please do not try to sway from the reportings, right? A lot of time, I mean, whenever a stress is happening to you, we try to remove that stress component. More number of cases you're gonna see directly, better you will learn. If you think that you will be able to learn just by looking at a case, that we will be showing you that this is how tuberculoma look like, this is how neurocystic sarcosis look like, and you feel that you will just go and read it, that is not gonna the way the thing's gonna happen. You have to make sure that you are trying to utilize maximum opportunity by seeing the cases and making sure that you are trying to follow them up as much as possible, right? So these are the primary key part in your residency. If I have to sum up what you should do in the residency, is try to report as many cases as possible and try to follow as many cases as possible, and that is something that is going to make you a great radiologist.
Yeah, I would also like to add one thing, that make a habit of accumulating interesting cases. And ये आपको अभी नहीं समझ आएगा. When you finish your MD, you finish your SR-ship, you will have a repository of interesting cases that will immensely help you. कोई आपको बाद में कहीं प्रेजेंट करना है केस, आपको कोई किसी को पढ़ाना है, you already have spotters. And the same cases you can make a PPT out of it and revise it before the exams as spotters. So what I used to do when I was posted in X-rays, I used to take pictures of interesting X-rays simultaneously in the phone. I used to make a PPT. phone पे बन जाती है PowerPoint. And that PowerPoint will, इतना फायदा होता है उससे. एक, you have list of interesting X-rays. You keep on accumulating good content with you.
One more point that I want to mention here is that you will not realize the importance of this today. At my age, I realized the importance of this, and this is try to create logbook of your cases, even if it is not mandatory in your program. For a lot of DNB residents, maintaining a logbook of the cases that you have reported or you have done is important. But for most of the MD programs, maintaining a logbook is not a mandatory requirement. But I'm telling you, this is gonna go a long way, because you are too small at this age. You do not know that what is the trajectory that you want to take in your life, right? You might need to go to US, you might need to go to UK, you might need to travel or go to Australia. You want to settle in different part of the world. You might need to appear for the exams where you have to apply for their licensing exams. You have cleared FRCR, now you want to apply for the GMC registration. You will be needing that logbook. You want to apply for Franzer, you will be needing that logbook, right? And lot of time what people do is then they create the logbook just by copying from one of the senior. So if you create your own logbook, this has got lot of validity. This and as Rishabh has mentioned that you have record accumulating those cases also, you might go into the academic career later on. That is going to be very, very helpful for you, like we teach nowadays. So lot of time copyright issues are there. Like if you have your own set of images, you are the king. You are the king. You cannot, like I lot of time now I need images.
Exactly.
So and you have to go to your different hospitals and you have to search for the image. But if you have it with you, the life will be relatively, as we always say, much more comfortable. So try. It will not take much of a time. We will share a sample format with you, that how does a logbook look like. It is the date, the exact procedure that you have done, or you have seen the procedure or you have actually done it yourself, and then what was the diagnosis, right? So this is how You're going to divide it a sample format. We'll be sharing it in our various WhatsApp group in which you are a part.
Yeah. So now let's look at what have we covered.
Please put your questions in the comment section.
Yeah.
Whatever kind of doubt that you have, if you do not want to put it onto the comment section and you're a part of our WhatsApp group, just put it on the WhatsApp group, or you can DM to any of us, to me or Rishabh, and we will try to address your query.
So what have we covered till now? Where are we? So till now, we have taken live 9 sessions. I don't want to call them lectures. Most of them were didactic interactions. We were taken 9 sessions, and I'm very happy to tell you that more than 200 attendance is there in most of the session, and this is something that that I feel very happy about.
It's a validation.
It's a validation, exactly, right? Because you're not teaching to first year or second year MBBS students. You're teaching to radiology residents who are serious about their careers, and you trust us with that. So thank you so much for that. So what we have done till now, we have started with chest X-rays.
And if you've attended any of the session, please comment in the section that did you really like it, or is there any scope of improvement that you are thinking. Please put it in the comment section.
So we started with cardiothoracic anatomy on chest X-ray, and I did a CT correlation to tell you how various structures look on CT and their 2D projection on a chest X-ray. We covered lines, strides, and various interfaces. Then we talked about the lateral chest X-ray, which is now the forgotten view, unfortunately. Important chest X-ray signs, which helps you in localizing an intrathoracic lesion. Approach to a mediastinal mass, which was sort of a continuation of the third class. Then portable chest X-ray radiography, which Sir took, which especially in an ICU setting and an IPD setting is very, very valuable. Then we moved on to some ultrasound topics like basics of an ultrasound exam, how to optimize your ultrasound image. We discussed few important pathologies of the right upper quadrant on ultrasound, and 2 important topics on CT scan, CT chest anatomy, and approach to urolithiasis, what the urologist wants to know. So this is where we are right now. And please mention them in the chat box if you like these classes and any other class that you personally feel that you want, because this is mainly a thing for you. What you want, obviously we'll keep that in priority. Now, what is the way forward? So this is sort of our plan, what we plan to take over this year. This is not a complete exhaustive list. I have sort of in a hurry mentioned a few topics that we will be taking class on. So we are done with cardiothoracic anatomy, lateral chest X-ray, important chest X-ray sign, approach to mediastinal mass, and portable chest radiograph. We'll be taking few important other classes as well. So in chest X-ray, these were the topics. Then I'll take a class on abdominal X-ray, so single class, and then basics of skeletal radiography. Now, approach to bone tumors is something that is very important in the later part of your residency as well, especially if you're an exam going PG. So these are the X-ray topics. And what we have done, and this is again something coming out from Rajat sir's mind, that let's divide the topics posting wise rather than system wise, because that is how you are posted in a residency, right? So in an X-ray posting, if you are posted, we want you to be well versed with these topics, right? So try to cover these topics, attend our live classes. We'll cover these topics over the next 1 year. Similarly, in CT, we'll talk about CT chest anatomy, which we have done. We are yet to talk about CT protocols. We are yet to talk about CT protocols. Terminology of HRCT imaging, imaging in pulmonary infections, CT and MRI anatomy of brain, vascular anatomy of brain, both arterial and venous, CT head protocols, abdomen CT anatomy, etc., etc. There is a complete list there. Now, this is a list which we want you as a first year resident to read, right? बहुत सारा लग रहा होगा देख के, but over.
Yeah. And I had a philosophy on this that rather than giving you the didactic lectures, the idea was that how you should learn in a residency, right? If you do not know that how to assess the, like, imagine that can we have some hands who can tell who are posted in the CT at this time, right? Can anybody put it in the comment if you are posted in the CT? And remember the first time when you saw the CT. Obviously, you are in radiology, that means you are amongst the top rankers of the PG entrance exam, right? But and you had some basic knowledge of the cross sectional anatomy because that is being asked. But imagine from there, now you have come to this. So if that we always say that if your foundation is right, so first you learn that these are the basic anatomical sections. This is how the normal structure look like, and then you go to this is how abnormality look like. Now, once you're gonna talk about this is how abnormality look like, then you train your brain. Okay, if this is an abnormality, there is a signal in the thalamus. Now, if there is a signal in the thalamus, and then you're thinking, okay, what are the diseases that may have an abnormal signal in the thalamus? But if you do not know where is thalamus in the brain, then how you will be able to do that? So this is how the broad lectures have been planned. A specific thing that you learn in first year, then you move to second year, and then you move to third year, and that is how this has been divided so that you can relate to it, that what you should know as a first year resident.
And similarly, if you're posted in MRI, so this MRI is not a complete list. I think थोड़ा सा कट गया है, but nevertheless, anatomy of brain MRI, MRI sequences, especially in spine, and what should you know in first year in MRI. So first year थोड़ा जल्दी है MRI के लिए. If you are a first year, at least spine पढ़ लेना बस. Spine itself थोड़ा बड़ा टॉपिक है. एक महीना पोस्टिंग होती है MRI में, आराम से you can अच्छे से complete spine. So spine infections, lumbar disc, spine tumors, spine trauma, small topics, one class each. We'll try to cover spine MRI in your MRI posting. And I also want you to know cover some X-ray physics and ultrasound physics topics as well, because most of the times होता क्या है कि फिजिक्स बस एग्जाम गोइंग के टाइम पर पढ़ते हैं, उससे पहले हवाई नहीं होती है फिजिक्स की. तो आई वांट टू चेंज दैट. फिजिक्स 40% आपका एमडी पेपर में आएगा, एंड डीएनबी पेपर का भी 40% इज फिजिक्स.
फर्स्ट ईयर का तो एक पेपर है,
अलग पेपर है. तो फिजिक्स अनफॉर्चुनेटली जितना भी बोरिंग लगे, जितना भी टफ लगे, जितना भी अवॉइड करना चाहो, नहीं कर सकते. यू कैन नॉट एस्केप फिजिक्स. So I want to introduce you to physics in the first year as well, and these are the topics that we'll take.
Yeah. So before we go forward, can we take few questions which are there?
Yeah.
So Bal Reddy is posted in CT, Pallavi is posted in CT. So do tell us that what are you learning in the CT, and tell me honestly, anybody who wants to write it down, that what was your first experience as a resident, first year radiology resident in the CT posting, and that I want to hear exactly from you. So Bal Reddy has another question which is very interesting. Sir, we have very very hectic residency program. Duty timings are from 8 a.m. to 12 night and little bit toxic. So how do study and fun? Please guide. Bache, this is the exact thing that which Rishabh has mentioned. Let's go back to this. You are posted in CT and see, no time for party, no time for padhai.
Yeah.
So this is the biggest problem
Yeah.
with the CT, and that again validate the statement that has been given by the Rishabh, right? So don't stress yourself too much.
Yeah.
If in one posting you are not able to get time for yourself, now what happens is that as we are advancing in technology, we are also getting less patient. And now, since this is the first month or the second month for most of the resident, I have seen lot of resident getting frustrated, thinking, oh my god, how come radiology be so hectic? I have never imagined it. Why the hell I have taken up radiology? Don't worry, all days are not Sunday, right? So you have a heavy posting, you will have light posting also, right? So this is how the things gonna go. Some postings you will have plenty of time, some posting you will have less time, so you will have to maintain the rhythm and everything. Remember, if you are a radiologist, you are the favorite child of the god. Then that's a philosophy that I have always believed in. So trust on the process. You have taken up radiology, God has given it to you for a reason. Like let's think positively onto that particular part. If it's a heavy posting, if your postings are extremely heavy, you should thank God that you are learning. If your postings are light, you should thank God that you have a time for yourself. So I mean, both the things are for your good. You have to always look at whether your glass is half empty or half full. It's all about your perception. Okay.
Sir, another student has asked, sir, I'm a DMRD resident at my institute. My institute doesn't give us a separate postings in MRI and CT. They mainly focus on ultrasound. So please guide how to do important topics in CT and MRI for DMRD.
So first of all, my understanding, Rishabh, correct me if you think that I am wrong. I believe that the most important thing that you learn in your residency is the sound fundamentals of radiography, ultrasound, and conventions, right? MR, irrespective in how much good program you are, you will not be an expert of MR even after a 3 year of residency. Law, I did my MBBS, MD, everything from Maulana Azad Medical College, and after that, when I moved to as a consultant in a private hospital, that was a time when I learned majority of my MR, right? And you will be surprised to know people after completing their residency, they used to come to me to learn MSKMR, right? So this is absolutely okay, but you should be versed with a theoretical part of CT and MRI pretty well during your post graduation, because the maximum theory that you learn is during your residency. After residency, you only learn theory which is case based. You see a case, you are unable to see that particular case, and then you learn it. So a structured theory you learn only during your residency. If you are unable to do that, don't worry. We are making this structured program for you, and the theoretical learning, we're gonna make sure that it is gonna be for you, right? Okay, so there are few interesting lectures that students have written. Aniket has written that can we make a class on reporting X-rays with various terminologies? When do you say fibroreticular? When you say reticulonodular? And all these things. So I think we
we
will
can
have a
do that.
separate session.
I'll
A
add
very very good suggestion. We're gonna add this session in our program, and this is the kind of advice that we want, because we want this program to be owned by the students, right? You tell us what do you want. We will pour our experience into this, both so that you can learn radiology. We are not gonna train you how to crack an exam now. We want all of you should learn radiology, and if there are any gaps in your residency program because of whatever reason, we act as that bridge so that your gaps can be filled, right? So this will be added.
Sir, what book should I buy physically to make single source? So, books ka I have already taken one session. Uh, it's on my YouTube, by the way. If you want a separate session on physical books, so what we'll do is we'll try to cover books in another session. ठीक है? कौन सी digital books हैं, कौन सी subject specific books हैं, कौन सी physical books खरीदनी है. ठीक है? What we'll do, I'll do a separate session on physical, digital, subspecialty based books because I don't want to club that into this. ठीक है? Another is MRI spine is going on. Only ultrasound postings are there. CT is done by PPP mode. So I think that is a common concern and a need that we incorporate some CT theory lectures, MRI theory lectures, because a lot of programs don't provide that.
And in fact, this is one of the biggest reason that Rishabh was very, very enthusiastic about this. That sir, students take up radiology. Every institute is not All India Institute of Medical Sciences.
Yeah.
Every institute is not PGI, right? So there are, I can divide the colleges into the programs which are a well structured program versus the program which are not so structured. But please remember, at the end of the day, you are getting a degree. At the end of the day, a structured program does not mean that you will become a great radiologist, and an unstructured program does not mean that you cannot become a great radiologist. Now it is completely on you. It is on your will that how much you want to learn. And I always had a dream, and that what dream was, your medical knowledge should not be limited to your medical college. Anybody who wants to learn should have resources available where they can get a guided learning. And that's why when Rishabh told me that, sir, we should guide and mentor students so that if they have some gaps, they will be fulfilled. So don't worry about it. It's a very, very standard part in lot of hospitals nowadays because of the scarcity of the radiologist, right? Um, I I know that it is disappointing for you, Sohail, at this time, bache, but at deep inside, you should be happy that there is still a scarcity of the radiologist, that the radiologist is not available on the site, and it has to be managed at a different or a remote location. Let me tell you very, very clearly, if given an opportunity to any hospital,
Yeah.
every hospital will want an on-site
In-house.
radiologist.
PPP board nobody wants.
Every hospital wants an on-site radiologist. So this tells you that all the people who keep on telling this to you, कि now radiology has lost its charm. So there is, you are the biggest example that even in a college which has a teaching hospital, this is what is happening, right?
Yeah. So what we have done, a lot of students, again, somebody has mentioned, sir, please provide recordings of the class, missed class due to hectic postings. And I agree, a lot, मुझे तो बहुत ज़्यादा messages आते हैं, a lot of students messaging because there are 200 plus students on the live Zoom sessions and we have around 8 to 9,000 residents across all social media groups, right? Telegram, WhatsApp, Instagram, whatever, right? Related to radiology. So what we have done, because it is an accountability on our part as well, and this is a need from your part as well. We want to finally, formalize this teaching schedule. We want to finalize, formally introduce to you what is our dream for you guys, and it is by you for you. This is not owned by us. This is by you and for you. So let us introduce to you Radiology Insights, a radiologist's guide to excellence. Now, we want to be there for you because there is a dying need for this in today's residency program. And in this Radiology Insights program, so this is not just for radiology residents, this is for any radiologist who needs upskilling. Okay, be it your DMRD, DNB students, be you are doing a SRship at a college or a hospital which is not so equipped academically, or you are practicing as a radiologist and you want to, upskill in neuroradiology, in cardiac imaging, in fetal imaging, and you want to see subspecialty videos. So we are there for you. We'll this program will have video classes within it, notes of those classes, solved DNB papers for your theory exams, spotter sessions because all MD exams, practicals around 20 to 30% weightage is given to spotters. So spotters are very, very important. OSCEs are very, very important. We'll cover them as well. FRCR, which is the most popular exam which all MD and DNB students somehow give now, that also we'll try to cover. A good question bank covering FRCR topics, DM entrance exams, fellowship entrance exams, and SRship, and most importantly, live workshops.
Yeah. We will be conducting some workshops in selected cities where the guidance about how to report the cases, what is an approach to a shoulder MR, what is an approach to a knee MR, what is an approach to perianal fistula. So all these practically relevant sessions will be given to you in the form of complete guidance with the workshops.
So this is sort of our, brief uh, thinking out loud. We are thinking out loud that, okay, we want to cover MRI film reading sessions, CT film reading sessions, fetal imaging workshops, cardiac imaging workshop, because, ये subspecialties हैं, 4 important subspecialties which lack expertise in medical colleges and DNB hospitals. So we want to, we will be covering important workshops throughout this program. Now, since we have finally, introduced this to all of you, let us sort of formalize this. And sir, up to you. When do you want to launch?
Yeah. So we will continue with our classes as we are going every alternate day. We are having
Yes.
a class. We will continue to have it. But as we have mentioned that these will be the components of that. Papers, spotters, FRCR, QBank, these will be incorporated, and a separate app will be launched for this to all of you. The tentative date of launch that we have kept is 7th of May, right? The date has been kept because we want you to first get accustomed to the branch, right? Because the counseling are still going on. There are still some stray rounds and everything that is happening, and a lot of time when after so much of the stress you have entered, we want you to get relaxed also. Rather, in the biggest or the interesting part about this is the classes that presently we are taking are just the live classes, whereas in this app, as lot of students have requested it, a majority have requested it from Rishabh, but I keep also getting some of the messages that, sir, please provide the excellent lectures that you are taking. And plus, now as the program will mature further, the specialist from different subspecialty of the radiologist will also be coming to guide you about to become a quality radiologist, plus how to approach the exam also, right? Because back in the mind, ultimately you are not supposed to give a competitive exam, but you have to still pass your exam also. So that guidance will also be provided by the teachers who have been an experience of taking your exams for years.
Yeah, so this is what we are planning. Video classes, notes, DNB papers, potters, FRCR, Q banks, and workshops. What we'll do is, as sir said, we'll continue to keep having the classes as scheduled. In the coming days, I'll post a list of topics that we'll be covering in the coming days. We'll invite some subspecialists also. They will also be covering the classes. And then we'll finally launch the product on 7th May. That is the tentative schedule from our side. So any questions that you guys have, please free to ask them. So yeah.
While seniors are reporting, can we search those queries of mine in Google @Radiopedia for quick learning?
Yeah, 100%. Radiopedia is a very handy tool for on-site reporting. In fact, even senior radiologists, young radiologists, everybody uses Radiopedia. It is a good source and authentic source. You can quote things from Radiopedia.
And I want to start reading physics. Which book should I begin with, Christensen's or Bushong?
So I read Christensen's.
I read two books for physics, Christensen's during my residency and FAR.
Yeah.
For the FRCR exam. Yeah. I have not read Bushong, so I'm not very sure about
so
this.
Bishong is a little bulky book as compared to Christensen's.
Yeah.
But it has more illustrations. So what a lot of my colleagues say कि Bushong is an easier book to read than Christensen's. Christensen's में theory बहुत ज़्यादा है, images, illustrations थोड़े
I
कम हैं.
found FAR to be much easy book to read.
थोड़ा compact है सर. FAR अगर background of physics हो तो बड़ा अच्छा समझ आता है.
I read it in SRship, so I already had that background.
I guess, yes,
Yeah.
sir.
And one more thing is that what was there at Maulana Azad Medical College, we used to have lot of physics seminars. So most of the physics that everybody has read in Maulana Azad is not actually from Christensen. We have read Christensen, but it's from those seminars.
Right, sir, right. In fact, college के seminars तो मतलब sort of cheat code है. मतलब अगर अच्छा पढ़ना है, जल्दी पढ़ना है तो seminars उठा के पढ़ो.
So those kind of seminars, directory can be can be provided to you all of. How important is physics for us? Physics is life, dear. If you really want to learn the subject, you need to know the physics behind it, right? My overall experience has been, and again, it will be difficult for you to realize at this step. Right now, you will only be learning physics because there are few questions that are there from the physics, right? But after few years, once you will become an established radiologist, you will realize that every artifact that you are thinking, every mechanism of MR that is happening, how the radiology or the X-rays are creating an image, it is based out of physics. And once you have understood that particular physics, it is much easier for you to report that specific case. So spend some time on the physics in the early part. It will definitely add some extra feather in your life as a radiologist. यहाँ कुछ नहीं होता, सेमिनार. हाँ, तो बच्चे यही, दिस इज दी, तो हम सेमिनार करेंगे ना, वी विल बी डूइंग सेमिनार्स फॉर यू, राइट? बट द ओनली डिफरेंस इज that in medical colleges seminars are presented by a resident, right? Here we will be doing it. Okay, one more thing that we forgot to enter into this is that we will be having your exam simulations. We will be doing because this is something that is very very close to my heart. We have learned this and we will be doing it for you. There is an interesting thing that we will be giving you a demo for that also. I call it as a radiology dumb charades, where the two residents, one will be given let's say a CT scan, and the second one will be sitting next, and the person who has been given a CT scan will describe the findings, and you have to draw those findings in the image, because on the basis of the description, if you can draw the finding on a normal image, that means this person is describing correctly and you are understanding it correctly. For example, let us say that I will give a case to one resident of an EDH. This EDH is present in the frontal lobe, and um, in the right frontal lobe. So the first resident will say that, okay, there is a biconvex hyperdense collection of 3 by 4 by 2 centimeter in size, and this resident on a normal CT will be drawing it by a 3 by 4 by 2 centimeter size. And once on the basis of your description, if you can draw it, that means both of you have learned that disease in the right way, right?
Yeah.
So a lot of such things we will be doing, a case, how to report a specific case, how to describe anything, case discussions. These will be some more activities. So the idea was what Rishabh has mentioned. Unfortunately, तुमको पढ़ाई भी करनी पड़ेगी. We want to change this narrative. In this entire program, we will change this narrative when you will say, sir, fortunately हमको पढ़ाई भी करनी है, right? So that is how we will try to make this radiology a fun way of learning, so that it doesn't add a pressure to you. You feel it like watching a movie for you, right? That's how we are planning it for you.
So I am very excited. Sir is very excited. I hope you guys also are very excited. We'll share a Google form with you guys. We'll circulate a Google form if you guys like. What do you think about this?
Felsen for physics.
Can I read Felsen for physics? Felsen is for chest X-ray.
Yeah, I mean, there is a new book that has come for the physics from Felsen. Then I am not sure, but I have read Felsen during my first year, but for the chest X-ray. But after that, I realized that chest X-ray made what was it?
Survival guide to
Chest X-ray survival guide.
Yeah.
Was a relatively easy book where you can understand chest X-ray in a far better way. Felsen was more about the experience of the Felsen with the X-rays, right? He's actually the father for the chest X-ray, not father of radiology, father of a chest X-ray, who has described almost every sign of radiology, right? Can you tell me which sign of radiology was not described by the Felsen?
Silhouette sign.
Yes. Silhouette was described by Flischner. Silhouette was not described by the Felsen. Otherwise, all other signs were described by the Felsen. Hilum overlay sign, hilum underlay sign, cervicothoracic sign, all are described by the Felsen. Silhouette was the only one that was not described by the Felsen. So the book is like, I saw 1,000 cases, and in the 1,000 cases, this is a finding that I see. So it's like a story, whereas a chest X-ray survival guide is actually like an organized way of learning the chest X-ray, right? Alright guys, that is all from our side. Thank you very much for this session. Please, we will put a Google form on our WhatsApp group. I am sure that all of you are a part, and if you are not a part, ask your colleague who is in your medical, who is doing the residency with you. He definitely be having an idea about the radiology WhatsApp group that we have for you. And do let us know that if you want anything else from our side. That's all from our side. Thank you very much for this session. Take care. And may God bless you all.